So today I had a pelvic floor assessment with my pelvic floor physical therapist, Dr. Kaitlyn Kakar with Thriving Mommas. So what we did actually was we recorded the session so you can see part of what she does postpartum. And I'll have you know, so I started seeing a pelvic floor physical therapist prior to even getting pregnant, and I highly recommend it because it's a way to work on my breathing and way to work on your posture, your engagement, and to make sure that you're using your core appropriately or even using your core. So I started seeing Dr. Kakar during my pregnancy, and we worked through some movement and just some foundational things, and then did some birth prep appointment and postpartum prep appointment, which I highly recommend both. Because one, she walks you through like birth prep of just movements to help get the baby in the position and just to help your body feel better. Postpartum, she helped with just like, how do I set up my house to help with postpartum movement and like even holding the baby and swaying with the baby, like doing that in a staggered stance as opposed to just feet equal. So she's a great resource. She also has virtual appointments available, so highly recommend her. Now, I did the pelvic floor postpartum assessment today. I'm only 3.5 weeks postpartum. Most pelvic PTs do 6 weeks, but she's actually moving, and then the holidays are coming up, so we just decided to do it a bit early. And one of her concerns was she sees me post on Instagram. We share several clients together. She saw me returning to working out, so she was concerned about that I was doing it too soon. So actually, we walked through like some of my workout, and she made sure that I was actually prepared. She did make a recommendation. I put this in another video that I don't need to be doing split stance workouts yet. I need to give my pelvis a bit more time to recover and just kind of get back in the groove. And so I've modified my Bulgarian split squats to just goblet squats, which she's happy with. So today what we did is we went to the pelvic floor assessment. Initially, her and I just caught up, and then we talked about like if I was experiencing any incontinence, which is peeing or pooping your pants, whether that's with sneezing, laughing, coughing, or just in general with an urgency. We talked about if I had any like pelvic floor tenderness, heaviness, any pubic bone pain, any like rib kind of flare or just like trouble breathing. And so just kind of did a verbal assessment, which I didn't include in the video because some of it was not really representative of what we wanted to show. And then we went through a pelvic floor assessment. So she didn't do an internal exam today. She has done them in the past, or with other clients and her patients. But I am still bleeding postpartum. And so one, she doesn't need to do that. And two, she can do her job without necessarily doing an internal exam and seeing how my pelvic floor and just breathing and core is engaging with one another. So what you're going to see in this video is I'm going to do voiceovers of basically what we're going through and working on. And you're going to just be able to see a little bit of the kind of service she provides. And again, if you want to give her a follow on Instagram, she's got great content, lots of information. Like I said, she does do virtual appointments. If you do live in the Phoenix, Scottsdale, I guess even Tempe area, depending on where you live, she does have an office here in the area. So hopefully you enjoy this. It's really to give you guys a glimpse of what pelvic floor PT is like. I should do one with our doulas too and just kind of interview them, I guess, because I've got a lot of support services, and mostly of that is just to help me and help my family, but also to give you guys some insight of what it's like to have support and to go through these appointments. So I hope you enjoy, and if you have any questions, like and comment, subscribe below, and I'll get those answered for you. What Dr. Kakar is doing in this video is we are talking about my posture and how it changes over time with having a baby. So your belly becomes more protruded, the back becomes more rounded, the butt tends to stick out, shoulders tend to lean forward. So what she's challenged me to do is be more back on my heels, and you'll see my toes come up and kind of me swaying back and forth with my pelvis. And then she's walking me through like how that should feel. Again, when we're swaying our baby, we're talking about swaying in a staggered stance, like I had mentioned, rather than side to side, which I was doing. That's just going to help with that posture as well, because what happens is the hips tend to protrude forward when we're holding baby, just to help hold them up. So now we're down on the ground. What she's doing is checking my ribs here. I'm sorry, it's not that good of an angle. You're unable to see, but what she's looking for is for any rib flare or asymmetries in the ribs. Again, because baby is growing and moving in your belly, your ribs have to make room, and so they tend to expand. This is why your bra size changes during pregnancy and postpartum as well. So we're looking at that and talking about bringing in the ribs and making sure we're breathing through them as well, because we want them to be flexible with our breathing patterns. So for here, she's just going through and showing that, and then I'm practicing the breath as she's walking me through it. So now we're trying to get a level back. So again, your posture changes significantly. She's modifying my positioning. Actually, my knees are up towards my hips, but it feels like I'm curved, like cradled in, and that's what she's explaining here. Because she's saying, okay, my back booty was popped, but now I feel like I'm curved in, like she just showed. And what's happening is I actually have a flat back, which feels different for me, considering the last 9 months I had a baby in my belly. So with this, what we're going to start doing, you'll see, is work on my ribs and bringing those in together. And then as we go through, we're going to work on kind of giving some thoracic mobility to just help that spine with breastfeeding and the position changes as well. So she's using her hand for tactile feedback and cues for me to send the breath into that rib area and focus on then breathing it in and breathing into the ribs. As I'm opening that arm, I'm creating some expansion in the back and just pulling on those muscles and some mobility. That area gets really tight during pregnancy, again, because of the rounded shoulders, and then with my breastfeeding and feeding in general, postpartum, because of the positions that you're in. So she's going to work on this side, and then I end up flipping to the other side, and I'm going to participate and do it on this side. Again, she's asking me if there's any asymmetries, meaning is one side tighter than the other. That's something I'm going to assess, and this is really important to give your physical therapist feedback on what's happening. So now she's going to check for a diastasis recti. So what that is basically a separation of the abs. And so again, she's going to check just when I'm in a flat position. Then she's going to check when above my navel, at my navel, and then below my navel. There are different areas that you can experience this ab separation, and treatment is going to vary based on where that is occurring for you. Now, I also see my head lift up and down because that's going to create some tension there. What she's looking for is the width of that ab separation as well as the depth. So we want to be able to create tension, and studies actually show that if we're able to create tension as opposed to just closing the gap, that's positive. Closing the gap is great, but if you're unable to connect to that portion of your body postpartum, then we have some work to do. And this is a great resource for helping you close that gap, changing the aesthetics of your belly postpartum, but also making sure your breathing and your exercises are appropriate for where you're at. So you're going to see her walk through that. And then what we're going to do is challenge the abs. She asked about which core exercises I'm doing. So I'm explaining, and she's going to assess what mine look like. So here I'm showing her the dead bug that I'm doing, and she's going to have me stop. We're going to modify and kind of break it down a little bit. That way we can actually make sure we're engaging appropriately. So what she found was that my lower abdominals kick in really well, but I'm not using my TA, so my transverse abdominis, as much as she would like. So what she's doing as we're breaking this down, she's talking about the different movement, and what we're talking about is breathing through these movements. But instead of me focusing so much on those lower abs, she wants me to focus on the whole core construct. So I was using a lot of lower abs in my rectus abdominis, which is essentially your 8-pack, right? And with this, she's saying, let's go and kind of think of closing that gap a little bit more. And really that TA is almost your behind the scenes core work. And so what we're focusing on is bringing that all together. So I'm getting a further core activation of more of the muscles rather than just the 8-pack and the lowers. And so I'm taking this much slower for her to assess, and we're going through, and I'm focusing on my breathing pattern. Next, we want to go into a bird dog. She was asking about this because I've been doing it in my postpartum recovery workout plan. And so she's just, again, assessing the things that I'm doing in my day-to-day life. What she's paused to take a look at was this low back. I tend to have a tighter low back, so we're looking at the mobility aspect there. So she was a bit concerned with it, but honestly, I felt like my low back has been the way it is because of my prior history of injury and exercise. So we were just talking through that and making sure it wasn't an issue. I do have quite dominant back muscles because I work them so much, or I overcompensate. And that's something that I have to work on too. And that was before pregnancy and postpartum. So now we're going to go into the bird dog and make sure that's all going well. Notice here I'm not rocking my hips very much, and I'm doing a slow and steady. She's really focusing. Her hand is currently on my belly to give me tactile feedback again. And again, I'm focusing on using my whole belly and my whole core to bring to bring that construct into the recovery phase. Because I don't want to just overuse one muscle. That's going to create an overuse injury, but then I'm also not using the other muscles to help recover and heal my body with the changes that pregnancy brings. So now we're going to do some more upright exercises. So she knows I'm doing squats and deadlifts. She wanted to see the squat. It's still a bit wobbly for me. And then what she was asking is, let's go to the bench. And then how low do I actually go right now? And so we're noticing that when I go that low, I have a little bit of a butt wink. So meaning my butt tucks under. And so that's something she wants me to watch out for. And what we'll do is regress back to the bench for the time being with the goblet squat instead of the Bulgarian split squats, and then go through and make sure that everything's okay before I progress without the bench. Now, this could be seen as something that's, upsetting or hurtful to my journey, or just like an ego impact, but really I want to build these foundations appropriately, because if I don't, I'm going to have to come back to this part of the appointment essentially and rebuild there. So for this part, she's looking at my deadlift, and what she was noticing is I'm pulling a lot with my back instead of using my glutes and my hamstrings to come up. So she's going to take my shirt up so she can see appropriately. What she's finding is, okay, so she wants me to go to that midpoint and think butt, hamstrings, butt, hamstrings, butt, hamstrings, and then coming back up with that. So even though I've been deadlifting for years and years and years, and I felt really confident deadlifting this week with the added exercises back, it's still something that I can work on. Now, was this an issue postpartum? Potentially. Is this something I can work on now and make it even better for myself of a deadlift form? So now I'm really engaging, thinking butt, hamstrings, butt, hamstrings. What we decided to do is almost go to that midpoint that you see, so just below my knees. And we're going to stay there until I'm able to feel more confident without using too much of my back to pull myself out of that. So from that point, we did pretty much all of the movements and assessments, and we just do a wrap up at the end here. There wasn't any other movements that I was concerned with. And so it was really great to have her in my space to give me this feedback. So what I'll do is take these kind of homework assignments and body awareness, utilize them, and then it's recommended I follow up with her in about 3 more weeks and see where we go from there.